And first of all, Lasciam Corla, I just want to acknowledge the people and the organisations in the Visitors Gallery and those watching at home this morning. Today is another day where we'll be discussing policy which deeply affects their lives. There are few groups in society whose opportunities and quality of life is so profoundly shaped by the government. Decisions voted on in this House can provide or restrict healthcare, can facilitate or deny employment, can assign payments that keep people in poverty or allow them to live with dignity. Even more significant is that individuals and cohorts most impacted have the least say. We try to do things differently in the Social Democrats. Our motion is based on engagement with the Oireachtas Disability Group, who have helped us understand the specific and large policy context. Disabled people, their representative organisations and advocates are the experts. At all stages, our decisions on disability matters should be guided by them. I hope this motion shows to those in the gallery and those watching online that the Social Democrats are serious about evidence-based policy, directly informed by the lived experience of those affected by those policies. Today we're going to talk about different statistics. While each of these is necessary and it is important, we must remember there are individuals, groups and families behind these figures. Each number hides the lived experience of almost 750,000 people, not to mind their families, partners, their carers and communities. This morning's discussion will highlight that disabled people are 3 times more likely to live in consistent poverty, that Ireland has the lowest employment rate for disabled people in the EU at 32%, and that families have to fundraise for basic equipment and vehicle adaptations the state should be providing. Statistics and examples only hint at the lived experience of a person's being denied their rights to full participation in our society. Numbers do not represent the stories of capable, complex humans who want to contribute to society, who want to live independent lives, nor the stories of parents who have had to fight for every basic state service from the moment that their child was born. Each one of these cases is about rights. Appropriate payments, healthcare, education, housing, and employment opportunities are not optional. They are not charity. They are the basics each person is entitled to. The UN Convention on the Rights of People with Disabilities guarantees the right to equal treatment, access to services, and to participate in decision-making. Every week at the Disability Matters Committee, the Oireachtas committee that oversees the implementation of the CRPD, hears about how the state is failing to meet those obligations. Nearly 1 in 4 people did not use the personal assistance public service as it was not available or suitable. The most recent figures I received from the HSE show that over 1,700 children were overdue an assessment of need, a system which has been thrown into further disarray after the recent High Court ruling on its inadequacies. Over 1,300 people under 65 are living in nursing homes because of a lack of suitable supported housing. Crucially, these are not just about a breach of rights. They are a part of a system that creates disability. Our understanding of the CRPD is through a social model lens that shows us how people are disabled by barriers in society, not by their capacities or differences. An extreme lack of accessible toilets and changing places restricts people from being able to socialise and leave home. An absence of flexible work arrangements prevents people from entering employment. And vastly insufficient social protection payments trap people in poverty and worsened conditions. Until ministers, government departments and state bodies demonstrate that they understand what a rights-based approach is and what the social model is, these fundamental issues will continue creating and compounding disability. Disabled persons organisations, or DPOs, advocacy groups and support organisations and local campaign groups such as West Cork Special School, FUS and the Parents Cork Advocacy Network help illustrate state failures. They reveal the daily breaching of rights and the predominance of the medicalised model of disability in public bodies and paternalistic treatment of disabled people. Significantly, the scale of the issues are catalogued by 2 government reports. The first is the Disability Capacity Review, published just under a year ago, quantifies the current and future need for disability support services. One of the key issues highlighted was, and I quote, significant levels of unmet need for disability services, and that changes in the size and age profile of the disability service population will add to unmet need over the coming decade. Addressing demographic change alone would not be sufficient, as the current level of unmet need is not sustainable. There is a need to spend between 550 million to 1 billion extra each year to meet the needs of the growing and ageing population between now and 2032. The funding is needed for residential services and supported housing, adult day programmes, multidisciplinary therapy services, personal assistance and respite. The Disability Capacity Review outlines the situation and is up to the government to respond quickly and sufficiently. Unfortunately, despite this report being published almost 12 months ago and being with the Department of Health for substantial time before then, there is no clear plan. On the 5th of April, the Minister for Health informed the Dáil that a working group tasked with developing an action plan for the period 2022 to 2025 had completed its work. Nearly 3 months later, that action plan has not yet been published. Where is the plan? Where is the urgency to meet the current unmet need, not to mind the future need? Our motion is calling for the immediate publishing of this plan, which must be supported by adequate resourcing and a commitment to implementation. It is not just a matter of funding announcements. There is a massive gap between government press releases and actual services on the ground. Recent cases of eating disorder treatment funding and other mental health programmes show us that funding can be unspent and reassigned. There is ambiguity around HSE budgets being allocated and spent. For example, I and many other TDs deal with cases where individuals are granted home support, all the hours, but only get a fraction of what they should. Then there is staffing. No service can happen without staff, without doctors, nurses, therapists, clinician and management and support staff. Children's disability network teams are unfilled. Our motion has to specifically ask for a plan to fill the 732 vacant posts for therapists providing services for children with disabilities. It's important to say that the failure of Progressing Disability Service is no representation of the amazing staff working in these teams. We simply need more of them. There is a pressing need to address the retention and recruitment. Excellent people who want to help people who choose a caring profession are leaving because of the poor conditions, low pay and the plummeting morale. Students in healthcare, especially nursing and therapies, receive little to no remuneration. Their first experience of working in the Irish Health Service is off-putting straight away. We also must have greater recognition and support for the role of healthcare assistants. Any action plan in response to the Disability Capacity Review must include a comprehensive strategy and accompanying packages to recruit and retain the staff. The second key government document is the Cost of Disability in Ireland report, published in December. Only after considerable pressure from disability organisations and opposition parties. It found that actual costs faced by individuals ranged between €8,700 and €12,300 every year. This is worth repeating. It can cost over 12,000 annually to have a disability in Ireland. Combine that with the systematic underemployment of disabled people and the massive unmet needs in care, and it's no wonder we have disgracefully high rates of consistent poverty and social isolation among disabled people. The cost of disability report written before the cost of living crisis stated that households, including a member with a disability, spent over 8% more on food and almost 10% more on fuel and electricity. This has been exacerbated by skyrocketing energy and food prices. Disabled people are among those who most acutely experience the cost of living crisis. This is not to take away for 1 second from the challenges and sacrifice of other families, but we know that households with a disabled member are feeling this much more. There's a glaring need for an action plan to address this crisis. After working with the Oireachtas Disability Group and looking at the information available to us, we are pushing for an effective, comprehensive form of action today. Money needs to be put into the pockets of people with disabilities. The government must introduce the cost of disability payment in Budget 23 of at least €20 per week, as well as an increase to the Disability Allowance by at least €15 per week. For a more long-term response, we want an action plan on the cost of disability report that outlines increased social protection and health payments and introduces tax breaks for disabled individuals and their families. Then we also need the promised action plan to implement the disability capacity review, to provide the public services required to help people live full, independent lives. We know it needs to be done. We're calling on the government to bring in the necessary short-term and long-term changes to help people exercise their rights and live with dignity.